My name is Virendra Patel. I'm the Chief of Vascular Surgery at Columbia University and New York Presbyterian Hospital. I have been a vascular surgeon since 2008, so 16 years. My specialty is vascular surgery, dealing with all types of vascular disease, including carotid surgery, abdominal aneurysms, and peripheral bypasses for limb salvage. And I've been with the VOOM Foundation for about 6 months to a year now, and this is my first mission to Nigeria. So this week we had the opportunity to take care of 2 patients who came in with peripheral vascular disease. They were both female patients who developed gangrene in their toes and had circulation problems. And the first patient, we were able to successfully treat her artery blockages which caused her gangrene with angioplasty in the cath lab downstairs. And after we improved her circulation, we did a partial amputation of her foot to take all of the toes that had the gangrene to be able to save her foot so that she can walk, as opposed to someone else performing a higher amputation in which she would not be able to walk with. The second patient is also a female patient who came in with circulation problems in both legs. She had a very bad infection in the groin, which involved the infection of the arteries. And on the left side, that similar circulation problem led to an amputation above the knee. So she can no longer walk with the left leg, but does move around with the right leg. And so we wanted to do everything to save that leg so that she could be able to continue to move around and be independent with her family. And so we did several operations on her. The first one is we did a angiogram and tried to do an angioplasty and stent in the right side downstairs again in the cath lab. And we were able to identify that she had a 100% blockage of her femoral artery, which is in the groin. And when we tried to get through it, we realized that the artery was infected all the way down to the skin, and she developed bleeding, which suggested that the infection in her groin skin area went all the way down to the artery, and really needed to treat that. So then 2 days later we took her to the operating room for a very long operation where we took all the infection out of her groin and we removed the infected artery. And then we took a piece of vein from her left arm and reconnected the arteries to improve the circulation to her leg. And then we let her recover for 2 days, and then yesterday we took her back to the operating room and did a partial amputation of her foot to remove the gangrene to help her heal. So both patients were very successful, and because of the facilities here and the excellent staff, we were able to completely treat them from start to finish. And my hope is that both patients will recover fully and will be back to normal function within the next month or 2 when they fully recover from all the surgeries. So open heart surgery is surgery on the heart and the valves of the heart, but the heart has to pump blood everywhere else in the body. And so all of the arteries that go everywhere else in the body is what vascular surgery covers. So I can treat arteries with blockages or problems that go up to the brain in the neck, and all arteries that go to the rest of the body. So anyone that has a blockage or damage or bleeding or aneurysms, which is a swelling or weakening of the arteries, a vascular surgeon can repair all of those. In addition to just fixing arteries, which affect circulation, patients also have veins which bring the blood back to the heart, and vascular surgeons also operate on the veins and fix the problems of the veins that can cause leg swelling or blood clots or other things. One of the simplest ways to screen somebody who has whether they have vascular disease or not is to perform an ankle brachial index, which is to measure the blood pressure at the ankle and compare it to the blood pressure in the arm. And if it's less than 0.9, that suggests that this patient may have vascular disease and that further testing is necessary. I think after we educate physicians and general medical doctors, I think an even more important education would be to educate the population. It can certainly be something that's incorporated into health class for children in school, so that they grow up being aware that peripheral vascular disease can affect their parents, their grandparents, and more importantly the patients themselves, can be educated. And I think things that you're doing here at your hospital, like the annual health fair, are very important because it educates the public in terms of what risks they have: high blood pressure, high cholesterol. They're evaluated by a doctor, and one additional testing that they can do in the patients that have risk factors for vascular disease is to consider the ankle brachial index, which we can easily do at a health fair for hundreds of patients, like the one that just happened recently, that will help make the public aware that this problem exists, and patients won't present with an end stage problem, but will present at an earlier stage, and we can prevent them from getting to an end stage.